We are back again at the Helen Rodriguez Awards breakfast for the Latino Caucus for Public Health, which is associated with the American Public Health Association at the annual conference in Philadelphia in 2019. It's a lot of words. We're with Dr. Alfredo Morabia, who is the editor-in-chief of the American Journal of Public Health. Welcome. Tell us a bit about the American Journal of Public Health and your role as editor-in-chief.
So the American Journal of Public Health is the journal of the American Public Health Association, the APHA. APHA founded the journal, created it in 1911.
Wow.
So it's more than 100 years old. And the reason why APHA created AJPH was two things. First of all, they understood that public health policy, transformation needed to be based on evidence. And so they wanted to have a journal which could provide those evidence. And they also understood, and this is a great quality and insight of the APHA, that the journal needed to be independent. And so this journal has been totally independent. It's unrelated to any corporation. The APHA has done a huge effort over more than 100 years to make sure that financially the journal could survive. And so the organization of the APHA is such that the editor-in-chief is also autonomous. I mean, there is no hierarchical relationship between the executive board and the journal except for hiring the editor-in-chief. But the journal is really independent and can decide what it wants to publish. And so that's about the journal. The journal is an incredible dissemination. It is read by most of the people in public health, from the federal level to the local level. We have every year 3.5 million people who access our articles.
Wow.
Yeah. It's enormous. We are cited 40,000 times every year.
Mm-hmm.
So it's a journal that has a lot of influence, of impact, and I'm the editor-in-chief. Mm-hmm. So what does it mean to be the editor-in-chief? It's a very interesting position because we actually produce the journal. Mm-hmm. So we don't only do the editorial part, which means receiving articles, making sure they are good quality, having the peer review. But once we've done with that, we actually produce the journal. There is a team of people who make the journal happen, and until it comes out either electronically or in paper. And then we have all this connection with specific groups in the association. The communication group that helps us, to make increase the visibility of our articles. We have connection with the other part of the communication sector of APHA, which disseminate our information on emails. There is all the media part. There are the people who actually do the lobbying for APHA and are a great resource because they connect us to many people who can contribute to the journal and who are making public health every day. So it's an incredible journal because it's like I like to say it's like a cortex, because we have this core of editors and production team, and around us there are literally millions of connection of neurons, that go to the federal level, to the local level. And we try to integrate all this.
Oh, amazing. You are also, I believe, a professor of public health in New York City. Tell us a bit more about that.
So I'm a professor of epidemiology.
Epidemiology.
Yes, and my main position is at the Barry Commoner Center for Health Prevention. Do you know who Barry Commoner was?
I confess I don't.
So Barry Commoner was a scientist who was once in the Time magazine as the American ecologist, because he was defending ecological theories. He was a very early environmentalist. But in 1981, he ran for president against Ronald Reagan.
So I should know who he is.
You know he lost.
I gather that.
But he did a great campaign. So that center is at Queens College, and it's part of the City University of New York.
I see.
And I have also an adjunct position because I've been since 1989 a professor at the Columbia School of Public Health, which is called the Mailman School of Public Health.
Okay, great. Well, today Dr. Morabia gave a fascinating keynote address, appropriately in Spanish, to the Latino caucus. And in some ways, I might summarize it as the linguistic determinants of public health. And I know that you are originally Italian and then Swiss, and yet delivering today's speech in Spanish. So tell us a bit about your journey and some of the things you were summarizing in terms of kind of the linguistic aspects of your own education and your own journey through life.
So yes, my mother tongue is French. So we've always spoke French in my family. But for some historical reason, we had Italian passport. So we, when we arrived in Switzerland, in Geneva, it was a French-speaking region, city in Switzerland. We were speaking French, but there was a campaign, xenophobic campaign at that time against Italians. And the reason is that there had been, after the war, a large migration of Italian, in particular from southern Italy to Switzerland, where there were jobs. And the way they were integrated in Switzerland was really very bad, you know, in the sense that they were seasonal worker. They came from for 9 months, and then they had to go back to their country for 3 months in the summer. They were living under very precarious condition and poor housing, etc. And they couldn't bring their family, etc. And so this generated in a country which, you know, had a lot of immigration always, but not this type, some xenophobic reaction. So we arrived there, and we faced this, and my parents didn't know whether we would be able to stay. So they sent us, my sister and I, to the Italian school at the Italian consulate. And so we had to do 2 schools, you know. We were, in the morning, we were doing the Swiss school, and after class, we had to leave our friends to go to. But that's not something you love when you're a kid, you know. But we did it, and I learned Italian, and also every summer we were going to Italy, and learning about the culture. You know, there are lots of museums and antique ruins that my parents loved to see, but there were also many other things, you know. It was in the 60s. I don't know if you know about the Italian cinema in the 60s, but that was something I discovered.
A lot of political upheaval, I think, in that time.
A little bit later. It was really 62, 63, 64. And so there was also, I mean, everything that happens to you when you're a kid, and you spend your summer somewhere, you know, you have also all those very vibrant love affair and everything. So really, I integrated this culture too, and I could see that I loved both. You know, I loved the Swiss one, I loved the Italian one, and I think this gave me some protection against the xenophobic atmosphere that was there. I never really suffered from it, but it was clear for me that it was very much based on ignorance, you know, and so that's it. That's why I think that having two cultures like that, not only in the habits, in the way you live, in the way you behave in your family, etc., but also the language and the literature and the larger culture is very important, and it's one of the things, you know, I thank my parents the most to have transmitted to me.
Yes, and today in the keynote address, Dr. Morabia talked about the importance of mother tongue in communicating, the differences between what can be communicated in Spanish versus what can be communicated in English, and the impact on public health. Share with us a bit more about that.
Yeah, you know, I think I speak several languages because I like that also. I learned them when, as an adult, like Spanish, I learned it as an adult. And I can see the difference between a mother tongue and a language that you learn later. When your language, you know, the one you learn before you know how to read, first of all, you never forget it. But also, you have a feeling when people speak that they're speaking right or wrong. And you know immediately, my mother tongue is not English because I'm talking to you. And you know, even if it's by details, that's immediately that it's not my mother tongue. So it's really a treasure. It's really something extremely important that either you get once or you won't ever get. And you can study Spanish or French as much as you want, you know, after a certain age, you'll never speak it, you know, perfectly, so that people feel, don't get some small detail. So I think that's something that we should all have. And if we can have several, that's a huge advantage. So if you are from a family which has a specific language like Spanish, and you live in an English environment, I think it's very important to keep both. And because they give you access to culture. You see, when I go somewhere and I can know the story because I'm a historian too. I know the history of many places in the world. But if I go somewhere and I don't speak the English, the language, sorry, it's like as if I were in the dark. You know, it's like being totally isolated, you know, in my small little cell. And but when I speak the language, it's as if someone were turning on the light. I can all of a sudden, you know, interact with the people. I can understand their culture better. I have access to their movies, their music, their literature. And that makes a huge difference. And so that's why I think languages are those keys, you know, that give you access to other populations that don't have the same native language as you do. So for public health, that means that if we want to have an impact, we need to speak in a way that people can recognize and understand as theirs, you know? Not that it comes from somewhere else, but it really expresses their problems, their needs, their objectives, their aspiration in a way to which they can relate immediately. And to do that, you need to have a language that is kept alive, that is kept strong. And that's why I pleaded today in favor of having of keeping the Spanish and making sure people don't forget it, that it's still taught, and even more that we make sure that we have a kind of global Spanish for public health that can be used in a way that is accessible for, that's 400 million people whose native tongue is English. That's the second...
Spanish, I think. Yeah.
Spanish. Maybe...
Yes.
Sorry, but thank you. Yeah, 400. There are less people whose native tongue is English than Spanish. I mean, people speaking English, there are more people in the world because a lot of people learn it.
Sure.
But in terms of native language, Spanish is more common.
So public health is a unique discipline that involves academic theory, evidence-based research, but it needs to be applied to populations and to families for it to be successful. And I think that's what you're talking about here.
Absolutely. I think the public health message has to be transmitted, and we need to communicate with people in terms that they can understand, but also recognize as theirs. I did this small experiment, it's not scientific, but I sent to 10 friends, people I know, but who live in different parts of the world, Puerto Rico, Colombia, Mexico, Argentina, Spain, Catalonia. I sent them the mission of the APHA. And I asked them to translate it. And I got 10 different translations. And I think that was very interesting because it made me look at the mission of the association differently, And, how do you translate something like public or the healthiest nation, I mean, it's, it shows you that we need to have a very thoughtful translation or generation of a different mission in another language we would import into English, but probably this interaction, between different languages will help us to be more effective.
Certainly, as I've been interviewing members of the Latino caucus and the awardee today, I've been discovering that, the Puerto Ricano is, yes, Spanish-speaking population, but a different or a unique culture to the Cuban and Dominican immigrants in Miami, to the Honduran, Costa Rican, Central American immigrants in Tennessee, and the Mexican immigrants in California, and today, of course, the original Spanish-speaking families of New Mexico, when New Mexico was Spanish and not English in speaking. And each subculture is different and has a different perspective. And I think that's what you're highlighting, that just in the translation of mission and vision, there's a different way of translating.
Absolutely, absolutely. But I also think that it must be possible to generate a Spanish which is global, that could be understood by all these different communities of Latinos. But we need to be very careful about that, because a term may mean something completely different in one community and the other, and it would look ridiculous, if you come with the wrong term to say something that is important for me. So I think it's I'm arguing for an active way of defending the language and developing a public health Spanish or a public health French, but Spanish is what we're talking about here. And I'm sure that what we learn from this process will be extremely important for what we say in English too.
Yes, yes, as we're doing now. Fascinating insights, and so pleased to be able to interview you and to have heard your keynote address earlier. Thank you very much.
Thank you for having me.
Alrighty.